So these are going to be live examples of these women here, what they're working on, the challenges and the opportunities that they face, and especially around digital technology. And so Crystal will tell us about the challenges she's facing as a woman, some of the opportunities she's seeing, and also how she's using digital and assistive technology in her day-to-day.
I will talk about something that I'm currently going through, perhaps in terms of my career. I have obviously overcome many of the statistics that you shared with us at the beginning of this chat a few minutes back, as we all have. And currently the issue that I am facing a lot with technology, or lack of, is having Parliament of Kenya be accessible to persons with disabilities, specifically those with visual impairment. Because historically in Parliament, even though there have been very, very few PWDs as parliamentarians, there's never been a parliamentarian with a visual disability. So I'm the first. But the issue is that because they have catered primarily for persons with physical disabilities, never visual, never hearing, it's difficult to transact business on the floor of the House. It's difficult to use the gadgets that are in there, the Congress gadgets. It's difficult to get the attention of the Speaker when I need to. Is he looking at me? Is he not? Is it my turn to speak? Is the mic on? You know, have I pressed yes or no when I'm voting? I might press yes for something I don't want to vote for. You know, things like this. They're very small, but they haven't been thought through yet at that, and that's a very high level. And if they're not being thought about at that high level, then of course, if we trickle it down to what's happening on the ground, just day to day in our homes, local homes, then you can see that there is a huge gap in that way. That means that there is no pathway for people like myself to even strive or think, hey, I can actually be there one day, because I can see lots of people with disabilities in Parliament. I can see lots of legislators. I can see lots of politicians making decisions for us who are actually out there and being enabled by that environment. That's one challenge that I'm really burdened by at the moment. And like I said in my intro, period poverty, and trying to think about period poverty for young girls with disabilities and women with disabilities is quite an issue. Because right now there's a huge drive for, you know, end period poverty, women in Kenya, these are the stats, this is the data, these are the numbers, but none of them talk about young women and girls with disabilities, especially visually impaired. I remember when I was young, and I wasn't born with a disability, right? So I acquired it it started in around high school. Around 14, 15 years old is when I realized through glaucoma that my eyesight was declining very slowly. And so the preceding years of, you know, being a teenager, puberty, trying to fit in, etc., and periods, menstrual cycles, I as a visually impaired girl did not know when my period was on. I couldn't even tell when I was spotting. Couldn't tell if I had, you know, stained my outfit. None of those things. And then that sounds really something that I can call people to come and help me with, you know, unless there's somebody who I really trust and I have full confidence in. And as a young girl with disability, as a young girl, you don't have trust or much confidence in yourself anyway. So that compounded into me thinking about today, now that I'm in this position, how are we helping in that area? What is tech doing to assist? In terms of even accessing sanitary pads and other products, is also a huge challenge, especially here. I mean, because that's what my research has been around. We know right now that privileged women, or at least women with access, who are non-disabled, spend about $9,000 on sanitary products in their lives. That translates to about 1.13 million Kenya shillings in a lifetime on pads, tampons, so on and so forth. 1.13 million shillings can buy at least 4 pieces of land somewhere. That is seed capital for a business. That is money for me to go to hospital and pay for treatment, because here we don't have extensive health care. That 1.13 million can help me to further my education, take me to PhD level even if I wish. It's a lot of money that non-disabled women spend, and what about that money, those resources, where are they for young women and girls all of us here, for example, with disabilities. And I really wish that that can be a conversation that we can start having at this conference. And like I said, as we move forward, what are some solutions that tech can provide in helping in that area?
When you acquire disability, or you're born with disability, sometimes you don't have a choice but to just turn into an activist. So when I was born without disability. I acquired my disability through, I got measles that left me blind. My family couldn't accept that I have become disabled, so they tried to look for medication for me. They tried to look for treatment for me until they have not lost hope, but until it was not possible for them to continue looking for this treatment. So I was taken to school that accommodated all children, but not children with disabilities. I studied there, but the teachers did not know how to take care of me, because the teachers are not trained to take care of students with disabilities. I remember going to school every day and coming home and learning nothing because the teachers did not give me attention. But the technologies are there, but our schools are not fully inclusive. Finally, I went to a school for the visually impaired, where everybody was like me. And there are facilities to take care of me. There are facilities to allow me to study. There are a lot of other kids who are not aware that there exist such schools, or who cannot afford to go to these schools because they are not everywhere. But we are advocating for inclusive education. Inclusive education where all facilities are there and allow persons with disabilities to study without any problem, without having to look for school that can accommodate them, to enable us get rid of stigma and discrimination, because the kids are learning with kids with disability from young age. I was lucky I went to that school, but later on, I was thinking, what if I never went to the school? Probably I would have dropped out of that school. I would have been uneducated. And coming from a community where education is not that important for women, then I would have been just somewhere, I don't know doing what, because a woman with disability without education is what the society in quotes call a burden to the society. I don't like to use this word. So after I finished school, I knew what I wanted to do. And what I wanted to do is advocate for a better life for children with disability, persons with disabilities. And one of our initiatives for our organization is called the Desert Wheel Race, our annual flagship event, where we advocate for different matters that are affecting persons with disability. This is an annual event. And we advocate for accessible technology, accessible digital technology. And I remember there's this girl, she's talented, and she's a painter. She really paints really nice. Her name is Mariam, she's from Isiolo. Mariam can draw anything in anybody. But nobody know what Mariam was doing because she's not exposed to technology. We found her through her participating in our flagship event, the fashion show. This fashion show exposes the talent of people, women with disabilities especially. This is a platform to create the visibility of women with disabilities. So when Mariam participated in this event for the first time, this event that brought together people from different counties in Kenya, they were able to see her talent, and we were able to expose her through the technology. And she was able to participate in so many different activities, in so many different competitions, because now she was exposed to technology. But how about those people who would want to participate in this competition, but the technology is not allowing them? I usually say, our impairments are not disability, but disability are the barriers put across by the society, the attitudes of the society, the structural barriers, and so many other barriers, and the technological barriers. The technology is very advanced for persons with disabilities, but our country has not advanced with the technology of persons with disability. We will continue advocating for this technology so that our inclusion becomes easier.
I'm going to speak on employment and some of the inaccessible healthcare services that we have in South Africa, maybe in Africa. So as I mentioned earlier, I am a language and study skills tutor. So what I basically do is consult with students on their assignments, mark their assignments, assist the lecturers with whatever work they cannot get done themselves. I don't know why. But before I got this job, I worked in 2 companies that offered me services that were different. So the first company I worked for in 2021, we were working remotely. I think it's because that's when we're still in some of the extreme stages of lockdown. And it was much easier because I knew that I just need to get up whenever, log in and do my work at the comfort of my own home. And I wondered, why is it that other companies do not do that? Because it saves me a lot of time, and also it is convenient. To commute from my home to work is expensive. Most of us know that adapted transport for persons with disabilities, they charge us 5 times more than what other people are paying. And some of the jobs that we are offered, they don't even pay us as much. So you'd find that you'd spend all your salary for you to get to work and not use it for some of your needs. Yeah, but then for that company, I managed to do my work. My contract ended. The following year, I got another job, and we're only expected to go to work twice a month. And I would pay 3,000 rands for transport for that 2 days. So it's 1.5 a day just to get to work on a vehicle that was adapted for me. But I still pay more than the person who just uses public transportation. And then this year, I was fortunate enough to get a supervisor that is willing to listen, because most of my work is easy to do on a digital platform. I can do my consultations with my students online. I can mark online. The only thing I need to do is just have access to internet that I still need to pay for myself. But then I'm not complaining because it is better than me paying thousands to go to work, thousands that I'm not even earning to get to work and then come back home and I'm still broke. So what I'm trying to say is there's still a lot to be done in terms of employment for persons with disabilities in our continent. And I'm not saying COVID was a good thing, but I would say there was a lot to learn there. We managed to get through it from the comfort of our own homes. A lot of people managed to get hired, persons with disabilities, and they had nothing to worry about because they were at home with their caregivers, and they have their assistive devices in the house, than to go outside and then you worry about who's going to take me to the bathroom, do I have to bring my own caregiver, and then another thing that I have struggled with is getting access to health facilities. I'm happy that Crystal touched on the issues that women have, especially when they are on their periods, because our healthcare services, they are close to none for persons with disabilities. You would go there for consultation and they'll tell you that we cannot transfer you onto the bed, we cannot help you to stand on the scale. If you can't do that yourself, then just tell us how you feel and then we'll see what to do. So the services that Fatima might get, I don't have access to because they do not have the facilities for me. If a deaf person wants to go for consultation, they have to bring someone with them because they will need an interpreter. Well, there are apps and assistive technologies that our healthcare workers can use to make sure that at least I get the privacy that I deserve. With that said, my experiences have convinced me that I have a big role to play in finding solutions to the problems confronting persons with disabilities, and also to ensure full effective participation of persons with disabilities in matters that concern them.
Being a woman with disability or a person with disability, it is very expensive because you need assistance now and then. Very unfortunate. Many people with disabilities, they are coming from very, very poor families. So you can find that they fail managing providing assistance on things like, for instance, in the case of me, sunscreen lotion, long sleeve garments, hats, and staying in the place where there is no sunlight, because our almost all activities we are doing in the sun. So you can find that to get activities which is out of the sun, it is very difficult. I remember my mother told me that, my late mother told me that when she was giving birth to me, she was very confused because she was wondering, bathing a child with the white skin. And when my father came, she was wondering that his wife face looks so sad. And he was asking her, "Where is our baby?" She said that she's there. My father go and he saw the baby with the white skin. My mother's mind was, maybe my marriage now it is an end. But good luck is, my father was a veterinarian doctor, understood where the skin coming from. So he went back to comfort my mom that we needed to thank God because he gave us a very nice baby, the fat one, healthy. I know what you are thinking. When we go back home, I will show you where this baby appearing, how this baby is appearing like this. So my mother was like that. I was raised in a good condition, but the problem started when I was starting my primary school. My teachers were not aware on how to treat me. People with albinism were suffering with low vision due to lack of melanin. So I was not accessing the writings on the board. When I was asking my teachers that maybe they will give me an extra work on the exercise book or paper, usually they used to say that they refusing. So to me, always I used to cry. I used to cry. Good enough, after my father go to school and asking my teacher, why did they refuse to give me the paper or exercise book for me to take note or doing test or exam? Because my father has a good post in the government, they were afraid and give me paper or test or notes to do. I thank God because I was very good in class. After having maybe a test or exam, mostly I was in top numbers. So I used it to shift various primary schools because of lack of awareness of my teachers. The problem continues to secondary school. But when I was in Form 3, I remember my headmistress in that school, she knew about Braille. And she was asking my father to take me out from that school and being trained Braille, which will be easier for me to access materials, reading materials like my colleagues. So I was studying my Form 3 for 2 years because of training of that Braille code. After that, I remember I passed my Form 4 to higher level, then to diploma up to university. I remember when I was in university, now I was grown up, I can advocate myself on those problems which I encounter, that is albinism together with the low vision. So it was easier for me in any place which I went, asking assistance to my colleagues and my lecturers. Thanks for these assistive devices, because it helps us people with disabilities to access daily activities as normal people do. And that's why even today I'm so happy being assistant lecturer in my university. Although it was not easy like that, because even when you are going for interview, people, they start to look at you and they say, is she managed? People like this managed to study until to reach in this level. So it was, as you see, having albinism, people can see you from very far, and it is easier to stigmatize you from very far. And that's why in Tanzania, they are killing us. They are lining each other that having hairs, bones of people with albinism, you can be rich. I remember when my husband wanted to marry, was asked, are you really sure you want to marry a girl with albinism? Sure. Walking on the street, introduce your friends that this is my wife. So stigmatization is all over. But again, as I said, we thank this assistive technology. It helps us looking normal, because we can perform activities as other normal people perform.
So we'll now open up to anybody in the audience that has questions for the panelists.
Which are some of the strategies that maybe can be put across to assist our disabled persons when they are away from school, to make them be comfortable and even continue nurturing the idea of being independent, believing in themselves, and able to maneuver?
In terms of talent, absolutely. Identify it, encourage it, I would say, number 2. And number 3, tell the kids, tell them that there are other avenues to making it, in quotes, in life. You can, our Bob Collymore, the former CEO of Safaricom, he used to be a painter in London before he came to head Safaricom, you know, and look at the legacy that he's left. So being a creative is actually, I think, something that can be transferred into very many other career paths.
I think we try to say things that might, you know, fire up a person to want to do something, but then we forget to ask them what is it that makes them tick. You cannot force me to go be a chef, because I just like to eat the food, not to make it. So if you want your child to be confident, to feel motivated, allow them to show you what they like. My disability doesn't allow me to do physical things myself, but I tell the person helping me what is it that I want to do, right? When I told my siblings that I'm going to Kenya, they were like, who's going to help you? Because they know my limitations, right? And I was like, oh no, they'll sort it out. And now I'm here. So they didn't say, no, you can't say they'll sort it out, blah, blah, blah. They just said, go. You'll see when you get there. So allow the person to find internal motivation and give them the platform to be who they wish to be.
Having disability, it should not be that you need to despair. No. Regardless how tough it is, you cannot change the situation. So we needed to ask our kids to accept the situation and to show the strength which they have, the ability.
It is the confidence that we don't have in ourselves that is denying us opportunities. What am I saying? I'm saying we are the ones who know where the shoes are pinching us the most. So please, let's be representing ourselves. If you're not invited to the table, take the seat and go there if you can.
Thank you again, and a big round of applause for our amazing panel.